आइए सर. So I am very happy to present this young person who at a young age became at a young age he became a professor because of his good work. We all feel proud about that. He was a recipient of the DBT Welcome Fellowship. He is the DBT Welcome Fellow. Because of his work, he has already received a DSc also, Doctor of Science, honorary Doctor of Science degree also. And because of this man's work, therefore I feel very proud of him. That unfortunately अभी वो adjunct में है, पर कुछ दिन में main में आ जाएगा. Because of his work, yoga as an adjunct treatment for schizophrenia has been introduced in the British guidelines. Because of the evidence that he made, because of the clinical trials that he made, because of the basic research that he made. So British, they were a bit smart. थोड़ा पहले हो गया वो. अभी तो अपने इसमें अभी तो I think India is going to take a leap now. We will now declare that mind-body medicine. At least we can make a resolution here, and we can send it to our bosses up there. That this meeting has resolved that mind-body medicine, like the Jardians people and semaglutide people, that is the main medicine. And you throw in, your medicine solution. So Shivram has been involved in doing some of these research. He made this career here. So you बताओ sir, ये क्या है? What is this graph, sir? You please explain here, sir. These graphs to us here.
Basically, demands we see, as Dr. Fatke was saying, usually the most seriously ill people. So the patients primarily come with schizophrenia or depression. This is particularly taken from the depression. That we usually talk of serotonin. I think she was talk of serotonin in depression, but it is not a unitary phenomenon. So we have essentially two kinds of neurotransmitters: excitatory and inhibitory. So the balance is what is lacking in most of these disorders. And excitatory usually is a neurotransmitter called as glutamate. And whenever there is too much glutamate firing, you get what we usually call as positive symptoms in schizophrenia. For example, you have hallucinations, you have delusions, you have agitation, people are violent. So this is too much of the excitatory neurotransmitter. Now what usually controls this is the inhibitory neurotransmitter, the primary one of which is GABA, GABA-aminobutyric acid, which is called GABA for short. So this lack of this influence is very well proved in depression and anxiety. For example, one of the most common symptoms in depression is what we call rumination. You can't get rid of that thought. मैंने ऐसा नहीं करना था, this is what I should have not done, मैंने गलती कर दिया. Although it doesn't serve any purpose anymore, that is gone. You're crying over spilt milk. Martin Seligman, one of the people, most famous people in positive psychology, actually made a statement about depression, that he was trying to investigate why it is that more women are depressed than men. Because the ratio is nearly 2.5 or 3:1. And he said, his statement is, women ruminate, men drink. So when people are faced with difficulty, women tend to ruminate. And men, drink doesn't just mean alcohol, it means some external activity. You go play some sport, you challenge yourself, you play football, or you try to beat the other fellow in a wrestling match. So they bring it outside, whereas women keep it inside, they ruminate. And therefore his theory was that, of course there are a lot of other hormonal things also, but primarily the way of tackling this is ruminate. And what stops this rumination is the inhibitory thing, which is GABA. So when you are anxious, you know that you can't do anything about your exam because it is in next 15 minutes. But you are constantly worried, that chapter I didn't read. What can I do about it now? You can't do anything about it. What usually stops this is the GABA activity, and unfortunately in these states GABA is low. So what we looked at is, how do you measure GABA? It's difficult to measure ideally in the brain. You have to do what we call as magnetic resonance spectroscopy, which is using the MRI and looking at the chemicals. It's not a very easy technique, it's very difficult. But there are alternate ways using what we call transcranial magnetic stimulation, much easier. So what we have found is that one is this GABA. Cortisol, we all know, is increased whenever you are anxious, whenever you are depressed, chronic inflammation, what Madam was saying in the morning, cortisol goes up. What does yoga do? Now, for example, we did a trial where we gave people choices, depressed patients. You could take medicine, you could do yoga, you could do both. We left it to the patient to choose. Right? I want to do yoga and take medicine, I want to do only yoga. And what we found is very interesting, that all the patients' depression improved, but the cortisol came down only in the people who did yoga. The depression symptoms went away. I am no longer sad. But what will happen when I stop the medicine? It is going to come back because cortisol is still high, the stress is still high, you are not managing the stress well. Whereas in the people who did the yoga, in both arms, whether you take medicine or not, in the yoga groups, the cortisol came down. So this, the most common question, I am sure, maybe in some of your disorders, there is no option to stop medicine, but in depression, that's the most common question that we face. When can I stop the medicine? And my answer always is, it depends on what you do when you are well. If you want me to stop the medicine 6 months or 1 year, you have to do something different than what you have been doing till now. Otherwise, when I stop medicine, you are going to come back to square one. Because your family is not going to change, your job is unlikely to change, the economic situation is not in your control. So what you have changed is yourself. So what we found is cortisol, and there is this brain-derived neurotropic factor BDNF is a marker of what we call neuroplasticity. Now the neuroplasticity is a big word in medicine nowadays. Everybody talks about neuroplasticity. Put it very simply, it's just the brain's ability to sort of repair itself or recover from something. What sir was talking about, resilience. It's a marker of resilience, if you want to put it that way. And that is very clearly decreased in patients with depression. Now, there is no direct link between BDNF and this, but we know that this is the whether. In fact, there is now research to say that there is a very good article by Dr. T.S.S. Rao in the Indian Journal of Psychiatry, that this is the final common mechanism of antidepressant action. Whether you are giving medicines, whether you are giving ECT, which is electroconvulsive therapy, whatever you are doing, ultimately, unless neuroplasticity improves, depression is not going to go, right? So this is what we found, that there is a very nice correlation between, we did this in yoga, maybe it show of psychology also. Because the thin line between so-called biological psychiatry and this thing is gone now. So, for example, there are studies to show that when we do CBT, cognitive behavior therapy for OCD, the brain changes are similar to giving acetylopram. So, what you do ultimately in the body, for example, many people are confused, even psychiatrists sometimes are confused. How does electroconvulsive therapy work? You give shock therapy. You're actually giving a shock and making the person have a seizure. So the seizure is not the therapeutic part. What the body does in response to the seizure is the therapeutic part. So developing, the body has to do something. The body changes something. What it does is it increases BDNF. In fact, ECT is the single strongest promoter of BDNF. So, some people ask, this is a very primitive method of treatment. Why has it survived the test of time? It survived anti-psychiatry movement in the US. It survived Tom Cruise with his anti-psychiatry. And in the West now, ECT survives because of geriatric depression. Old people having depression because you simply cannot give them medicine. They are already on 10 anti-diabetics and that and this. And so many interactions happen. It messes up their other things. So there are patients, I used to work in Australia, old people used to come and tell me, don't fool with me this time, give me ECT. Right? So, and all the ECT services in most of the Western countries are run by psychogeriatricians. Right? Because there is no option there. You need to get them out of severe depression. Medicines you cannot give at higher doses, they will have side effect, they will have postural hypertension, fall down, break their femur gone. So ECT works. Now, how does it work? This is the mechanism. It makes the body respond by increasing neuroplasticity. And this graph actually shows that there is a very, very nice correlation between BDNF going up, cortisol going down. So your neuroplasticity is getting better, stress is coming down, and this is what is likely to lead to permanent change. So if I stop the medicine, person continues some sort of yoga. Not everybody can do 1 hour of yoga a day. We are not asking them to do that. But if you change your lifestyle, maybe a bit of pranayam you do, a bit of mindfulness you do, at whatever time you can, it's likely that the depression may not come back. Because the treating depression is not difficult. Preventing depression from coming up is extremely difficult. Right? So this is something that we found. In schizophrenia, the mechanisms are a little different, but this one is very much true regards depression, that it is a deficit of neuroplasticity. Like when you talk about the allostatic model, nowadays depression, everybody uses this term very, there is a depression in the stock market, there is a depression in the road, it's become very, so in fact there is a group of psychiatrists who are saying this word should be taken away and replaced by the word melancholia. Melancholia is the true depression that you see in 50, 60-year-old people who come with absolutely no way to live. What do I do in my life?
People actually, very handful.
Very handful. That is the true depression. You see it in Japan, in the elderly population who are perfectly physically healthy but have no purpose in life. They have no children, most of them. They have worked all their life till 65, and now that they are not working, what do? They are healthy. Physically extremely healthy because their habits are very good, they eat less, but what to do? So it's a very big problem in countries like Japan, how to cure this, and it doesn't look like medicine is going to solve the problem because the real problem is no purpose in life, right? So when you talk about severe depression, biological thing is really neuroplasticity. We talk all we want about serotonin, but this is what really is going wrong in these people. If you bring them back to a stage where the neuroplasticity goes up, they will handle their own problems. You can't make everybody divorce and have a new partner. It's not possible. You have to live with the same family, isn't it? But most people have resilience which we do not take into account. Like Dr. Fadke was saying, we treat patients as though it's something that I can only. But patients want to do something themselves. What is it that empowers him or her? Doctor giving medicines is, okay, it's there. But what do I do to empower myself? That is why this 85% of people, although you may be giving everything, they want to do something on their own. They want to use their brain, use their body, do something. And if you ask them, they will tell you. If you are welcome to that idea, they will tell you. Otherwise, they will hide it from you. But they will still do it. So what we have done is now this, for example, you were talking about randomized controlled trials. It's a very artificial arrangement. You randomize people forgetting what they want. You have no, in fact, the best thing to know is nobody should know what is a randomization. Triple blind randomization. Sabko blind kar do. But then the patient is very passive recipient. Dawa leta hai aur kuch nahi karta hai. But do you believe that they will do that? They will read on Google. They will go to the neighborhood gym. They will do something. They will take some nutrition. Somebody will be advertising that this helps depression. They will be doing all these things. And if you say, if you ask, they will tell you. And then you say, no, I will tell you what to do. These are many things that you can do, you will do it. And that improves compliance to medicine. Because once they understand the place of medicine, they ask you, why are you giving medicine first? There are a few psychiatrists whom I treat in my practice. And they say, I know all about all this stuff. No, why are you giving me medicine? I know of this medicine. I say that to get you out of this situation, you have to use medicine. Isn't it? That's a very, very important question because I am not anti-medication. Medicines have a role, but the role is very specified. I am not saying you have to be on antidepressants for all your life, but right at the moment you need antidepressant. When you come out, what you do, then maybe 6 months down the line you may not need it. Once you explain this, they are very happy to take the medicine, thinking that it's an aid for me. I am getting out, and then I can do those things. So if that is the role that I think we have.
So we coined jokingly three simple terms for you to remember this. So one is that we call as a jolt therapies. Jolt, he just gave an example of jolt, like a jhatka. ECT हार्ट में भी देते हैं झटका, नहीं कि हार्ट बंद हो जाए तो डिफिकल्ट. Surgery also is some kind of a झटका, because you have to do now कि surgically इसका anatomical correction is possible only surgically. So शुद्ध पंजाबी में कहा जाए तो झटका थेरेपी है. Okay. झटका और jolt is one type of interventions. Second type of interventions is a push. You have to continuously push the system. कलीना मैडम ने अपने को हेल्थ के डायमेंशन कल बताया था डिटेल में, अपने को जो सब पता है वो कि unfortunately if you are not careful, your doctor is not careful and you land up already with disease and target organ problem. तो फिर तो push करना पड़ता है क्योंकि then there is no way that that allostatic system can come anywhere near to. So you need a continuous push in order to keep the गाड़ी on the road. Okay. And a third category, nudge, where a suggestion is sufficient. So therefore it's like an induction, na? As he said कि आदमी फंस गया है rumination में. He needs just a sort of an induction therapy, to kind of you move him out of that situation, and then the person is possibly able to go on. So you have a jolt therapy, you have a push therapy, and you have a nudge. So all this kind of possibilities. वैशाली मैडम अभी अपने को obesity का बताया किसने? हर experience about obesity.
So when sir was saying about the nudge, this is what actually we are using in practice in obesity therapy. That in obesity therapy, what is happening is that these patients have undergone a lot of therapies. They have got frustrated, they have got depressed, and they have lost hopes. So this nudge, the induction of that initial weight loss is very important. So normally if you go by the traditional books, they say that you start on diet and exercise, then you go on counseling, then you go on behavior therapy, and then you go on treatment. But in fact it is this kind of a therapy which works the best. You induce them first with weight loss medicines. First you try to cut down their appetite with the biology change. First you try to cut down their cravings. Then you work on their medical aspects first with medications as a first aid, induce them, and then you find that after 2 months of say semaglutide or some other therapies, they are all willing to follow diet and exercise. They are all willing to control their cravings. They are all willing to follow whatever guidelines in terms of maintenance you want them to. So the same principle which Dr. Shivram told about depression works for obesity. It's a lifetime disease, lifetime management. But if you are going to wait for that person to start with that sequence of what is mentioned in the traditional books, it never happens. It never happens because a person who is craving for sweets, you are telling him you curb your cravings. If a person is already eating at night time, you tell him don't stop eating at night time. It can't happen because there has to be a biology change in the brain, a chemical change in the brain occurring, and that is why the role of anti-obesity medications is coming up with all these. So Anish, you have anything to add to this? Your views on this? After late, okay, fine. So okay, tomorrow you'll add on this.
So next slide, maybe you can have a next slide. Shivram sir, next slide for you.
Formulating
करू दे यार, resilient करू दे लोग.
resilience.
So as I was saying, in schizophrenia the mechanism is slightly different. So schizophrenia is the most severe disease that we treat, and here the imbalance is primary in the thought process. The problem is the thought itself is distorted, and there what we have seen is that again I was talking about positive and negative symptoms. Positive symptoms, everybody knows that when people hear voices they think people are trying to kill them. So this is typically positive symptoms. But the bigger that we have very good medications. Actually our antipsychotics are very good at handling this. But the other side of the picture is the negative and the cognitive problems which people have, especially something called as social cognition. So if I see somebody, I don't know whether that person is angry with me, happy with me. It's very difficult for these people to make out what is going on in the other person's mind. So this is, there's a very famous this thing by Dr. Rizzolatti called mirror neurons. So Rizzolatti is an Italian neuroscientist. So what he found is that, for example, monkeys, all of us know, when we do something, they imitate it. Right? How are they able to do it? How do children learn? How do we all learn? It's very commonly told that children don't learn from being told, they learn from seeing. How do they do it? That is because there is a group of neurons in our brain called as the mirror neurons, which are able to imitate what is seen. You don't need to necessarily need to do that activity. Our brain can learn by just seeing, right? So this also, suppose there is a child here and the child is crying. I don't need to know why the child is crying. I also feel sad. That is what human beings and almost all animals have this. That if somebody is distressed, we also feel distressed. I may not even know why, but crying and somebody smiles, I feel like smiling. This is because of our mirror neurons. What we have found is that in patients with particularly two disorders, autism and schizophrenia, this ability is gone. So they are not able to understand the mindset of another person without being told. Right? So even if they see somebody crying, really that brain doesn't react in that way. And it looks like the medicines which we give for schizophrenia are not able to correct this entirely. Right? So what we have found is adding yoga to that changes this in a very dramatic fashion. So we don't really need yoga to help with the delusions and hallucinations. But what actually makes their life change is this. So if I am at home or at my office, if I don't know whether my boss is happy with me or not, unlikely that I will be able to work well, even if I don't have delusions and hallucinations. Other part is cognition, memory. These are again things that we do not have good medicines for. Right? So there, yoga we have found to help, and two major things we have been able to see. One is this mirror neuron activity using something called as the infrared spectroscopy, FNIRS it is called. It's a very simple machine which is not, I call it as a poor man's MRI. It's just an external application. It can only see to the top 2-3 mm of the brain, but that's enough to give an idea about blood circulation. So we have seen mirror neuron activity improve. Second thing we have seen is there's a hormone called oxytocin. I'm sure all of you would have heard the bonding hormone or the love hormone, whatever we call it. And this is a very critical thing for the mother-baby bonding. How the mother is able to make out why the child is crying. Is the child hungry? Is the child in pain? Only the mother can usually make out. This is because of this increased oxytocin in postpartum women and pregnant women. Oxytocin is very high, and that gives this capacity. That's why women usually have a better empathetic thing than men, because their oxytocin levels are usually higher. So this we found again is reduced in people with schizophrenia. And this and the mirror neuron together, it makes them lack the ability to empathize. And with yoga, we were able to show that plasma oxytocin went up. Not only that, the gene expression of oxytocin also went up. This is what we have been able to show with yoga. So yoga, that's what Dr. Fadke was saying, that in the NICE guidelines in the UK, they've added yoga as one of the complementary therapies, particularly for patients with negative and cognitive symptoms. So that is something that we have been able to do research on.
Good.
Thank you so much for your neuroscience basis about yoga. Even in schizophrenia, I have seen that the patients who have taken medicines for many, many years, and there is something, about serotonin. So even if we are producing oxytocin, now when Sir is saying that there's a lack of neuroplasticity in the brain in a depressed patient, I'm just talking about our mothers, our moms. What they were doing, they were preparing lunches and dinners for everybody. My mom, she was happiest when she was serving everyone. And she used to call people and she would plan a lunch, she would plan a dinner, then come on, what we're going to make, we'll buy the ingredients. It was an activity. And that is like a group activity in the family, that somebody is coming, my brother is coming, so-and-so is coming. So serotonin is being secreted, oxytocin is being secreted, people are coming home, and when you're doing this repeatedly, a circuit is being made in the brain, the neuroplasticity is also improving. So what I saw was that our mothers and our grandmothers, what they were doing was they were praying a lot. They were connected with the divine, and that was giving them oxytocin also. That's what my presumption is. I just want to say one thing. Today, in this world of instant gratification, we've lost all that. I tell my daughter-in-law, come on, my friend is coming, let's prepare some lunch or dinner. She says, Mom, what? Let's order this Swiggy and there is Zomato. So there is no pleasure of feeding anybody. There's no pleasure of serving anybody. And this patient of this schizophrenia patient. She's an excellent example. She's my friend for many, many years, and she was a very bad schizophrenic. She was into violence and all that. And she has been taking medicines for so many years. And now, accidentally, what happened, her daughter was to get married. And when her daughter was to get married, her daughter said that आपके अंदर बहुत creativity है, आपको ये सब मेरे लिए करना है, मुझे ना बाहर के लोगों से नहीं करवाना है, आपको मेरा स्टेज बनाना है, आपको मेरा खाना पीना का देखना है. And you know what happened, beautiful what happened was, she started preparing for the marriage of her daughter about 1 year in advance. So she started going to her hometown. She said, मुझे hometown में करना है, यवतमल में. She's from Bangalore, that यवतमल place, she has to go there. And she found people to work for her. She found people to make flower arrangements. And she found people to do the decoration of the stage. And the khana, she wanted to give the typical khana of that place. And all of these things, she started becoming better and better. And her psychiatrist is a very big psychiatrist in Mumbai, Hari Shetty. Hari Shetty never stops medicines. And he, when she's talking to me, she said, "Ek goli kam kiya, dusra goli kam kiya." And today, she's off her medication. What I'm trying to say to everyone here is that creativity, habit formation, something that you love to do, which you do again and again. Mandala. I've seen my friend, she started doing mandala. She became all right. She started taking up some habit, something that you really enjoy doing. And we are off habits because the only habit in our life is to look at our screens. If we can just go away from the digital part in our life and we start reading a book, we start enjoying a book for the sake of enjoying the book, or cooking for the sake of serving someone, or whatever it may be, whatever makes us happy, we become happier. Bengali women, if you see, there is very less depression in Bengali women. You know why? They're preparing. Now there is Gitanjali, there is now this function coming, now there's this function coming, now they're going for song, they're going for dance. I'm in for company of a lot of Bengali women. I learned Rabindra Sangeet with a teacher who is Bengali, and she will teach me the Bengali songs, and I learn the lyrics and I see on the YouTube the meaning of the words. And I started grasping Gitanjali. I started grasping Rabindra Sangeet, and my happiness quotient went up. I'm just telling everyone, just close your eyes, and as you said, purpose of life, what are we here for? What we are doing, why we are doing what. I just wanted to give this message. Thank you so much.
Well said, ma'am. And I think two things definitely which I can tell that why we do this workshop. One is there is lot of giving. There's lot of giving in this workshop. We give a lot of our knowledge, our experience, our sharing. And second is the sharing. You see that nobody is asked to stay alone. Everybody is staying in twin sharing, and none of your partners know each other in the beginning. But I don't see any fights happening. I don't see any grudges going at the reception, saying that I don't have a bed cover or I don't have an extra towel or what. So these are the two purposes that I think the workshop definitely serves. And I always feel that the pleasure of giving is more than the pleasure of receiving. So I think it is our neuroplasticity which is improving in the bargain. So I hope that we carry our prefrontal cortex on a larger scale. We build up at least a millimeter every year when we are doing this kind of activity. So I'm thankful to all the team members, and they have helped my understanding.
After the prayatna comes the sethi. After the wait comes the reward. Reward is sweeter, after the waiting. Yesterday, Shivramji, they all saw actually in the muscular relaxation, the GABA effect, आप जो बोल रहे थे ना, आपको दुबे सर बताएंगे आपको GABA effect कैसा feel होता है. To you with their new titles, I am not presenting anything. So I have put people in alphabetic order here. Last year we ran a 1-year fellowship program, and over and above that fellowship program, the idea was that these people should do something substantial, to make them worthy of that fellowship. So some people really did, great activities. So we are very happy. Fellowship essentially implies friendship. As Veena said, friendship is all parasympathetic. So collaborations, friendship, parasympathetic. Yeah, lambar ya, pat ya. So So what I will do is that I will call out the names and those people, please come here, so that so the Center for Behavioral Medicine, which is a fully empowered legal trust, it has all the possible government, you can say, approvals, etc. to do the activities, and the activity main mandate is to be active in the domain of research and education related to the health matters. So as you know that last one whole year, these people, we went into a lot of nitty-gritty related to these activities, and plus these people themselves have been very actively involved in all the activities. Okay, so we are therefore very happy to confer these fellowships on them. Kiran Ambekar. Kiran Ambekar, as all of you know by now, is a exceptional person, dual qualification in modern medicine and allopathy and Ayurveda. So he's a dual qualification in that. And in addition actually to attending the fellowship thing, also many of you know that his very important contribution to this whole idea is a cohort of the autonomic. He has been measuring actually people with HRV, doing the interventions, remeasuring them. So he has a large cohort now. Outside of Lina's college, that is perhaps one of the largest 150 patients cohort that he has, and with interventions. So he's a sort of a real pioneer in that domain. And second is that he is someone who also has a good degree of expertise, as all of us know, in the field of adaptogens. And he's helping us further with that project. So very well deserved, to be the first in the line. Veena Phadke was also part of the fellowship group. And of course, for her commitment, because all these people, they have shown exemplary commitment also. So she attended Harvard, she attended CBM, and now she has opened her unit out there. In addition actually to doing all the research part. Priya Mardikar, because Priya Mardikar has also not only completed that, but now shown tremendous commitment and is part of the Navya Medical College team. So join us, Priya, here. We are very proud to welcome you to the CBM Select group of fellows. Vaishali Deshmukh, of course, Vaishali. Of course, you also. You are also part of the fellowship group. 4 years you have already done enormous hard work. Maybe if I were to be a university, I would have conferred even PhDs also on these people. They have done tremendous work. But that is what I could do within my legal limitations. Then Vani Kularli. So what you don't know about Vani Kularli is that Vani has been part of our task force, Indian Psychiatric Society task force on mind-body medicine. And she is the one who actually has volunteered for 6 months during those mega COVID hospitals. So totally selfless service into that, exposed herself to the disaster situation when people were avoiding, even when the doctors were avoiding a time to have any physical contact with patients. She as a psychiatrist, she went ahead and in Mumbai, she provided her voluntary services for 6 months, because this club also requires, that all these people must be disaster management ready. They should be willing to actually subscribe to this whole philosophy of resilience through accepting challenges. Okay. Next person, Vaijayanti Lagu Joshi, because Vaijayanti also in the tremendous transformation from brain to bone. She is the first person who crossed the barrier. She crossed the entire spectrum from
Bone to
brain. And she is there. What she told you partly today, that she has also been into this epidemiology study at the start of her career, and that a very important activity which is taking shape out of her clinic is the biomechanical phenotype of yoga. What we spoke about, that how the biomechanical apparatus of a person should be, and when it is compromised, what should be done about that. So our great friend Reinhard Jogle, he spent actually till midnight, in her clinic. One day we went there in the evening till midnight. She was there, her patients were there, one after the other. He was working onto them, and she already started conducting the surveys, etc. I already told you, about her work and activity camps, etc. So she studied a lot. She is one of the most meticulous clinicians I met. So she makes one of the most meticulous clinical notes. I see a lot of her patients. In fact, they all send me a lot of patients. So thankful to them, for running my business. He also deserves actually to be an honorary, although he was not part of the fellowship group. Shivram, come join us. So honorary fellowship also to 2 people. Yes. So because of Shivram's strong support, I could run that task force. In Indian Psychiatric Society is one of the most conservative organizations. Madam Bharati Bahl is a part of that. That organization is nearly impossible to move anything into that organization. Yet we had the good trick actually to move things there. We had a task force. Exactly 4 years ago we met in Munich. Yes, Shivram sir. Exactly 4 years ago, Shivram was there, I was there, Vaishali Deshmukh was there, and we met Reinhard Jogle, we met Norman Sartorius. We had this meeting in and he will arrive. He had said he will arrive, but he hasn't arrived up till now. So this man, he is our senior colleague, and he was really instrumental to convince the leadership of Indian Psychiatric Society that a task force should be formed. And the most, you can say, lethargic association amongst the medical association, it came out actually for the first time with an initiative which was really path-breaking. Mind-Body Medicine Task Force. They entrusted me the responsibility. Shivram was there to help and support me. And it is from there 4 years ago, that thereafter Vaishali, was quick to buy the shares into the entire MBM. Not only shares, she bought the whole company. She opened a new company rather. We are now employed in our company. So therefore we are very happy, that
I am in student.
yes. And this should therefore enormously please Dr. Solanki also. Today is actually her day. Then it's not only Harvard, there are also Indian institutions. A trust is people's trust, it's a public body. It's not a university, so not some people, so they are, you can say, popular choices, people's choices. So give them a big hand. First famous Mind-Body Medicine in India. Last but not the least, Professor P.N. Gangadhar सबसे नीचे है. Yesterday was Gangadhar's birthday actually, and at nearly the stroke of midnight at 24 minutes past 11 p.m. he sent me this WhatsApp message to give best of luck to all these people. So you have the blessings of no less than Gangadhar about this activity, and congratulations to you. I think your entry into the CBM, fellows, friends of CBM, it enriches the activity of CBM, of course in addition to whatever activities that you do in personal domain. So this is a stronger sort of a connection between the trust and you people. As I told you, CBM is a trust set up by the Nimans alumni, and I am sure that it will further try to strengthen this activity through this public and government kind of collaboration and cooperation. So thank you so much, and I am happy that a lot of young people are here to witness that, because next is actually now Sonal's and some other people's turn. I am waiting, that they will also produce some such work which will make us feel compelled, to also put them here in this list. So I wait for them also to generate that. There were other people also into the fellowship batch, and I am sure that after these people, now they will do more work. There are of course, more higher titles also available within CVM, by the way. Okay, so more rewards also to be attained. So keep working. Okay, we can give you higher titles, people's titles, like they have in movies, no? That jury choice, and then you have actually the people's choice. So they are not chosen by any university, but they are chosen by the people and chosen very carefully for exceptional and meritorious work, that they are doing, and most importantly for their commitment, to this task, which relieves me a great deal of. कल कोई तो मेरे को पूछा था, सर आपका लड़का है क्या, मेडिकल में है क्या, क्या करता है? मैंने कहा यार मेरे अभी बहुत बच्चे हैं, मैंने कहा मेडिकल के आगे काम करने के लिए. So thank you so much, welcome once again, into this fold, and thank you so much. Our privilege.
Last 3 years the sessions would continue, and there was a period when he was actually ill. Despite that, he was taking our classes, giving each and every detailed explanation of the very, very complex concepts. So all we over here, yes, sir, we owe it to you. Thank you.
Sundays.
पन्नास संडे ऐकला सर. He was going to tell you the story of couples, so I think good we can discuss that tonight then, because there are a lot of stories in regards to Fadke madam and sir, so I think he'll tell you better than I will tell you. So now we'll come to that tonight. So